Hello, everybody. It is me back again. This is my May update video. So yeah, I'm just gonna do like a quick rundown of what's been going on in my life so far, and yeah. All right. So basically, on February 24th, I went to the Mazzoni Center in Philadelphia for my trans intake session and also my blood work and stuff like that. Got all that done. Then I went back March 10th to start my hormones. And yes, I've been on hormones for 2 months exactly yesterday. So I'm gonna basically be going over what's been happening and all that stuff. So yeah. So first off, these are the hormones that I've been taking. I've been taking 50 milligrams of spironolactone, which is the testosterone blocker, and 2 milligrams of the estradiol, which is the estrogen I take. The estradiol, or the estrogen, is like an oval blue pill, and the spironolactone is a circular yellow orangey pill. I take them twice a day, and yeah, there have been some changes and stuff that's been going on, so we're going to talk about that. First off, just like a little disclaimer, just because I'm noticing some things in my transition now doesn't mean everyone's going to have the same effects. Everyone's body's different. Everyone reacts to pills differently. So just because I'm noticing things now doesn't mean someone who, started at the same time or is going to start and gets to the point where I'm at now is going to notice those same things, because everyone's different. So let's just get that out there. Everyone's different. Okay? Okay. So mostly all the changes that I've noticed have been mental and emotional. I have been an emotional roller coaster. I've been on an emotional roller coaster since I started. Mostly it's good. Like, I've noticed some positive changes in the way I think and my mentality, and I've gotten a lot more confident in myself, which is wonderful. And then, of course, I have had my horrible mood swings where I'm just like either really angry, I get irritated really quickly and agitated, and I just can't, and I'm like, let's not go into that. And then I have my moments where I'm like really sad and I'm really like, I just want to be alone and I don't want to see anybody, I don't want to talk to anybody, just leave me be. And those are like, it's variations of that. Either I'm like really super happy, or I'm like in a really stink mood and I don't want to see anybody and like I'm pissed off, or I'm sad and I'm like crying and whatever. On 2 occasions I have like had a little emotional breakdown at work. One time my manager just said something like kind of in a joking manner, and I took it to heart, and for a good 10 minutes by myself I like cried about it. It was weird. It's like it was like when I first started, and like I didn't know how to react to it because I'm used to his personality. He usually jokes around with me and I'm like fine with it, I laugh, whatever, depending on what he's saying. But this time I like really took it to heart and was kind of offended, and I started crying. Yeah. But we talked about it since then, so he's been nice, which is different. But anyways, yeah, on the other occasion, someone said something out at the desk when I was standing out there trying to help a guest, and the guest went crazy, and like I was just not having it, so I just had to leave and go and be by myself to recuperate my brain because I was just not happy. But yeah, other than that, it's basically like I've just been a lot more confident in myself, and just trying to stay positive, keep that train rolling, figuring out what I want to do with my life and where I want to go with it, and just having that mindset and just trying to stick with it. It has not been easy, let me tell you, girl. Life has been trying. Like, so many family issues have been going on in the past 6 months, and I'm just like, and I started hormones like 2 months into it. I mean, 2 months ago, and now it's like all like just my mind just cannot handle it. But I'm trying. But thankfully, I'm seeing my therapist usually once a week, so he helps me, which is wonderful. What other changes? Physically, not many changes. I have noticed that my skin is just beautiful. Like, I love it. Like, just amazing. It's gotten a lot smoother. My breakouts have like all but ceased, kind of. It depends on if I'm stressed out or not. But usually I'm like, my skin is like really smooth. Hair quality has like really changed a lot. Like, I remember one day I was like, I brushed across my leg, and this was like when I first started. And it was like awkwardly smooth, and I was just like, what in the world? Like, that's awesome. I didn't expect that. It was one of the changes I was expecting, I was hoping to happen, and it did, so I was like really excited. But yeah, I've shaved my legs, and let me tell you, like, the hair density, everything is much different. Like, it's growing back a lot slower, and the hair that is growing back, it's really light. It's not as coarse and dark as it was before, which is amazing. On my face, like, the hair still grows back pretty quickly, and it's depending on how long I go without shaving, which usually I shave like every day. The hair there, it hasn't changed that much, but it's a lot easier after I shave. It's like smoother now, and the hair, it grows like, it still grows pretty fast, but it's a lot easier to manage now, which is wonderful. Now, let's talk about nipples. Little nipples. Oh my god. When I first started, like, I would say close to like the end of the first month, stuff was happening. Like, girl, like, not even close to the first, like, close to the end of the first month, like, right in the middle or like towards the beginning, nipples were like, steadily, day by day, I would notice that they would change. Like, before, they were like really small, like not noticeable at all. Like, when I was cold, like, they would get like hard, but they were still like really small and unnoticeable. So it was cold that entire like first few weeks, and like they would get hard and it'd be a lot more noticeable, but I didn't really pay much attention to it. And then as more days went by, like, they just stayed like big, and I was just like, wow, my nipples have increased in size, which is kind of weird, but hey, I'm all for it. I'm loving it. Until the pain started. First, it started off as little like tingles, and then it slowly increased to like more of a dull ache. And then when I touched it, it was just like, oh my god. It was horrible. I remember, like, I was playing with my dog, over there. Say hi, Cinnamon. I was playing with my dog, and she like stepped on my chest. And normally she does that because she's crazy. And she usually steps on my nipple, and I never really thought anything of it before I started hormones. But this time she stepped on it. And let me tell you, I died internally. It was so painful. I wanted to kill her. Like, I was just like, you are so lucky I love you, because, oh my god. And then this other time, like, I was at work, and I had to like get this binder to go over some of my paperwork and whatever, and I was gonna bring it back to the area that I worked in. So I had it like this in my arms, and I was walking through the hall, and someone like ran by, so I had to like squish against the wall like this. Oh my goodness. Excruciating pain. I had to like go back to the office, and there was someone in there with me at that point, and my eyes were like so watery, and they're like, oh my god, are you okay? And I was like, yep, I'm okay. I just pinched my finger in the door. Not fun. And as of now, they have increased in size, and they still, like, every once in a while, like, they'll be in pain and like really itchy, and then other times it's like not even anything. So yeah, I'll show you. Let me just turn to the side. So yeah, these are the nipples. It's not really much, but as you can see, it's a difference than when I first started, because I would never see them like this. Like, there was nothing, and now it's like more noticeable, I guess. um, and recently, like, I was like getting ready for work, and I was like putting lotion on my body and stuff like that. I was shirtless, and I saw like the little developing breast, like excitement, like I can see and feel the curve of the breast like starting to like become fuller with tissue and fat, I guess. So that was exciting. Like I would show you, but I'm not trying to get flagged for anything inappropriate, so we're not gonna do that. But yeah, so that's been the past 2 months on estrogen. It's been a roller coaster. And most of the physical changes don't usually start until 2 months and onward. So expect more changes with the next coming months. And I will make sure to update you monthly on everything that's going on. So I love you all. Have a wonderful day. Happy belated Mother's Day, and I will see you all in my next video. Peace. And just like a quick side note, on June 8th, I'll be going back to the Mazzoni Center to see my physician, get my blood work done, see what my levels are with the hormones, and hopefully I'll be getting an increase in my estrogen and spironolactone. So hopefully I'll be going from 2 milligrams of estrogen to 4 milligrams, and from 50 milligrams of the spironolactone to like 100 milligrams. But we'll see. I'll let you know in my 3rd month. Bye!